ministers, the national coordinator, the DG and CDC, other members of the task force, my friends, gentlemen of the media, good evening to you all. While you're all aware that the chairman of this task force is in self-isolation, in total compliance to our own rules and regulations. So I'll stand in for him for today and for this briefing. I wish to welcome you to the national briefing by the Presidential Task Force on COVID-19 PTF for this day, Thursday, the 17th of December, the year 2020. The events and statistics of the last 2 weeks within and outside the country of Nigeria have been very mixed. On the one hand, the cheering news of the COVID vaccine, while on the other, we have witnessed spikes in number of infections at home and abroad, and especially at home here in Nigeria. The real threat is upon humanity and the progress made in the global health sector in the last 5 decades or more. In Nigeria, the indication is that we have entered a second wave of infections, and we stand the risk of not just losing the gains from the hard work of the last 9 months, but also not losing the precious lives of our dear citizens. The PTF believes that if we do the right things and adhere to the non-pharmaceuticals interventions and step up our testing and detection, loss of lives will be minimized and the rising curve will be flattened. Let me remind you about our cumulative numbers in the last weeks of week 49 to week 51 as follows. Week 49, 1,843. I repeat, week 49, 1,843. Week 50, 3,918. Week 50, 3,918. Week 51, Monday to Wednesday, half of the week, just half of the week, 1,889. It is also considered important to avail Nigerians the global situation in the last 3 days. Global cases crossed the 74 million mark, now at about 74,516,681 cases. United States of America crossed the 17 million mark, 17 million. The WHO Africa region has crossed the 1.6 million cases mark. The global case fatality ratio declined by 2.2%, while the WHO Africa regions remains at 2.2%. United States of America continues to record high daily case incidence of over 248,000 686 on a daily basis. And on the WHO Africa region, Nigeria ranks number 5 for both highest cumulative cases and highest cumulative death. Nigeria ranks number 5. The foregoing analysis, which will be elaborated by Honorable Minister of Health and the National Coordinator respectively, is to remind all Nigerians that 1. We are in a potentially difficult phase of the COVID-19 resurgence. Number 2, assessing the hope offered by the arrival of the vaccine is still some time ahead. Number 3, that vaccines alone cannot cure the virus. Rather, a combination of initiatives, including the traditional non-pharmaceutical interventions. That more than ever before, we need compliance. And that we shall escalate our risk communication and community engagement strategies to higher levels this time around. Lives have been lost, still being lost, but we must slow down the pace of the spread, and now. And also to say that at the rate at which the numbers are rising, should be examined, and that our vigilance and compliance with the non-pharmaceutical interventions should be intensified. Ladies and gentlemen, last Tuesday, the PTF held an end-of-term technical session. It afforded the PTF the opportunity to assess the progress made and the present dangers that confronts us. The report of the PTF will be submitted to Mr. President on Tuesday, 22nd of December, 2020. Current realities, however, point to the fact that the course of further opening up of the economy may have to be reviewed. The festive session, this festive period, is here, and we remain conscious of the fact that large gatherings, events will take place. It is our strong advice that all non-essential trips be cancelled outright. This thing is real. It's happening daily. Infections are rising, and the spread is going farther and farther, and we cannot be complacent. We urge dear Nigerians to please avoid large gatherings. Before I invite Honorable Minister of Health, I wish to state that for the first time since March, our dear chairman of the PTF is absent from this briefing. As you are already aware, he is self-isolating out of abundance of caution and in line with our protocols. We wish him safety and wish the members of his family very quick recovery, and all of those out there who are infected by this deadly disease. And I wish to invite my colleague, the Honorable Minister of Health, followed by the DG, NCDC, and the National Coordinator to update you from the technical perspective. I thank you very much for listening.
PTF, Honorable Ministers, the National Coordinator, Director General, ladies and gentlemen. I used to receive, or rather I used to hear, congratulations, we are flattening the curve, and my answer was always, don't rejoice too early. we are not yet out of the woods. And that is what we are facing now. That the number of confirmed COVID-19 cases continues to rise, with the total number now 75,062 as of this morning. A record number of 930 new confirmed cases were diagnosed yesterday, the 16th of September, 2020. It is the highest daily number recorded since the virus was detected in February 2020. And this is what we have been warning about for many weeks, and it gives cause for us to worry, not only about the causes, but also about the course of events as they unfold over the next few weeks. As the time of festive season and holidays approach, the risks are going to increase. Many people will want to celebrate. Many will want to crowd into shops, markets, places of worship. Many will want to travel with mass transit transport. Or even many will be flying into the country from abroad, including from high-burden countries. All these are circumstances that are proven worldwide to accelerate COVID-19 transmission. And they have caused explosive increases in COVID cases in other countries. I want to use this opportunity to urge all Nigerians to do all they can to stay in their homes, except you have a very urgent case or you have a very good reason to want to travel, because you increase your risk, especially inside crowded transport, crowded buses and taxis, and also the risk of meeting people and finding yourself in a crowd when you do not want to be in a crowd, and finding yourself in gatherings and and where people gather where you cannot easily get away. Our epidemiological trend has already started to show that the COVID curve is rising, with the total number of active cases now 7,087. And there's a corresponding increase in the number and seriousness of cases requiring hospital admission, in high dependency units for oxygen treatment, or in ICU intensive care units for mechanical ventilation. If we include those who are in hospital with severe symptoms for being observed, the need for more hospital beds will become acute. And this is an indication of what the second wave is. For those of you who look at television frequently, you will have seen the pictures from Europe, from Spain, from France, from the UK. And we still want to be able to avoid that. And to do that, all of us have a role to play, both those in government and those who are not in government, those who are doctors, nurses, and those who are not. This is a common problem, it's a national problem, and we all have responsibilities. Following this new surge, the Ministry of Health is working with federal tertiary hospitals on the reactivation of all treatment centers. We are assessing resources available and resources needed, and we are alerting frontline health workers to be on standby. We are strengthening the COVID-19 home care treatment protocol for asymptomatic and mild cases and community-based care, which is usually organized by Primary Healthcare Development Agency, to manage asymptomatic, mild, or moderate cases in a way that they will not infect others. We have also commenced the inventory taking, and we plan to distribute a wide range of resources available in our warehouses according to need. These include personal protective equipment, various commodities, equipment, and consumables for deployment to treatment centers. To strengthen manpower needs, we shall step up continuous nationwide training of various cadres of health workers, especially ICU nurses and intensivists, biomedical engineers, and so on, to ensure proper utilization and maintenance of ventilators and other equipment, especially the critical ones, while we also improve knowledge and skills of personnel as we learn more and more about COVID-19. On the back end, our technical working group is around the Primary Healthcare Development Agency or the Ministry of Health. It's examining modalities to obtain access to vaccines for Nigeria. We are in conversation with WHO Gavi on the COVID COVAX AMC facility to support about 170 lower and lower middle income countries to which Nigeria belongs to access anti-COVID vaccines. At a presentation to the Ministers of Health of the ECOWAS region today, under the West African Health Organization, the African Regional Director announced that COVAX had been assured vaccines for just about 20% of the quantity of vaccines that is required for lower, middle, and low-income countries. Many high-income countries, wealthy countries, high-resource countries have secured first rights to vaccines and already paid down for their citizens. And in some cases, we hear some have paid for double their number of citizens. We continue to closely follow issues related to vaccine development. We are holding talks with representatives of vaccine developers to work out additional or, if need be, alternate sources to meet national security needs. Nigeria will be working on a mix of public, private, and external funding to meet the payment. We understand that the World Bank has made a facility available on which countries can draw. The African Union has also set up an African vaccine acquisition team aiming to acquire vaccines for up to 60% of the population. The fourth meeting of the ECOWAS Ministerial Coordinating Committee on COVID-19 held today, of which His Excellency the President of the Federal Republic of Nigeria is the ECOWAS champion. The committee applauded the decision of the Federal Executive Council to approve the decision of His Excellency the President to approve the reopening of our borders at 4 positions, and also recommended easing of cross-border travel and trade in the ECOWAS sub-region. Harmonized guidelines have been developed and agreed upon as an important tool to control cross-border movement and control the pandemic or risk of the pandemic. The ministers were also concerned about the resurgence of confirmed COVID-19 cases in the entire region. and also concerned about the decline in adherence to non-pharmaceutical preventive measures. And we all agreed, among others, to strengthen risk communication and community engagement. Among decisions taken was to propose a uniform rate for pre-travel COVID-19 testing for travelers within the ECOWAS region. The rate is lower than the international non-regional rates. It's a proposal. In addition to the events that have happened in the last few weeks in the health sector, is that the National Blood Transfusion Service of the Federal Ministry of Health has launched a 10-year National Blood Transfusion Strategic Plan to focus on a more efficient blood service system for Nigeria and set a robust regulatory framework for voluntary, non-remunerated blood transfusion. Our goal is to have a strategic safe blood reserve that ensures availability of up to 1 million units of blood at any time within the country. I wish to remind all of us that we are clearly at the beginning of another phase of the COVID-19 pandemic, and it is critical that we remember our civic responsibilities not only to ourselves, but to the community, to our fellow men, if we are to respond decisively to still try to prevent a resurgence that is catastrophic. And therefore urge all citizens, all, to play their part to adhere to very simple non-pharmaceutical measures. Very simple, such as appropriately wearing your mask, using alcohol-based sanitizers, and most especially, physical distancing. Physical distancing, you cannot get COVID-19 unless somebody passes it to you. And nobody can pass it to you if you are a safe distance from that person. So therefore, it's just logical that if you keep a distance that's good enough. I see Mr. Bassi looking over his shoulder to see how far he is from the next person. If you are a safe distance, you are safer. If you are wearing your mask, you are safer still. If you are wearing and using your sanitizer, you are the safest you can be without expenditure. So, being in a crowd and not wearing a mask strongly increases your risk of contracting COVID-19. And the risks are, of course, higher for persons over the age of 50 and above, and those with comorbidities such as hypertension, diabetes, and other chronic diseases. Again, let me say that if you are not wearing a mask, your risk is also higher. So when you wear your mask, you are protecting yourself also. It is always of benefit for citizens to fortify their immune system by improving their nutrition. I will recommend fruits, vegetables, daily at least, for every person. Thank you for your attention.
National Coordinator, Permanent Secretary, gentlemen of the press. My comments will be very brief. I think everyone has harped on, rightly so, the increase in cases, consistent increase in cases over the last few days and weeks, and the consequences thereof, like we've been saying for many weeks. So I'd like to focus on one specific issue, on the role of public and private sector leaders over the next few weeks and months. You know, everywhere, every location that we find ourselves in will most likely have someone leading it. Every gathering has a leader, every office
has a leader, every church has a leader, every restaurant has an owner. It is really the responsibility of these leaders to ensure that these non-pharmaceutical interventions that we've been talking about are implemented. We carried out a long campaign about individuals taking responsibility. But there are also leaders that have to take responsibility for the implementation and enforcement of these measures in your context. So I'd like to charge all the leaders, whether public or private, to restrict the physical meetings happening in their settings. And if they're happening, to follow the guidelines that we have set and to ensure that meetings are virtual as much as possible. Let it not be up to the attendees. Let it be up to the leader to enforce that that happens. Let the leaders of restaurants, the owners, the directors in offices and ministries enforce that if people are not wearing masks, they should not enter that premises. Every government premises in Nigeria has a responsible leader. The leaders can enforce these things. Every bank has a bank manager. That bank manager can enforce that these things happen. Let's not leave the responsibility to the customers and the clients. I'm charging the leaders of all these settings to take responsibility for ensuring compliance. Compliance to temperature checks, compliance to hand washing prior to entry, ensuring that your facility has the hand washing facilities needed, and ensuring that people carry out these appropriate measures. So to make this clear, we have sent out a public health advisory of 10 steps that we expect every leader, public or private, to enforce with people around them. We want leaders to show that when you come less than 2 meters to you, to understand that there's a risk involved, both to the person close to you and to yourself, and not to be seen in public doing that. Because if you're seen doing that, it reinforces the message that it is okay to be done. So please, as we go home or travel, if we have to, we have recommended that people should stay at home as much as possible and not travel. But wherever you are over the next few weeks, please help us help you by doing the things that we have agreed are necessary at this time of the outbreak. And my final few words are recognizing that the end of the year is coming. We're encouraging people to postpone their celebrations as much as possible to next year. But if you must celebrate, please do so responsibly. We will harp on this over the next few weeks, but we're really asking everyone to take this message that if it is absolutely necessary to bury your dead, for instance, which is needed sometimes, to do so responsibly and to be the leader to ensure that all your guests and everyone that is coming for that ceremony, whatever it is, whether it's for joy or for pain, does what is necessary so that in that celebration, we do not create more problems for ourselves. So this is a very sober time for reflection and work across the country. Healthcare workers, many of them don't have the luxury of thinking about going home for Christmas. Many of them will be working on Christmas Day and on Boxing Day. It's inevitable with the number of samples all the labs in Nigeria are receiving right now. Let us stand by them. Let us make their work easier by implementing what we need to implement so that we can end this year on a hopeful note. We really hope that that curve that has been going upwards over the last few days does not continue to go upwards, but it's really not up to us. It is us on this side. It's really up to us collectively to do what is necessary. I'm sure the PTF and all our leaders at the state level are thinking about measures that might be necessary to implement over the next few weeks. I'm sure nobody wants to implement any harsh measures, but none of us can sit back and watch things escalate too much. So we need to work together to see how we can sustain the very fragile gains that we have as we work towards the hope for a vaccine sometime within the first quarter or next year. Thank you.
Honorable Ministers, DGs, PAMSECs, ladies and gentlemen of the press, good evening. I know it's been a very long day, so I'm not going to spend too much time talking, but today is a very serious day. As some of you already know, I'm going to spill out a few facts, and these are facts. It's not fury. Our cases are going up. They are going up not because we are testing more, because we are testing more, but they are going up disproportionate to the increase in testing we've had. If you look at FCT, between week 49 to 50, the number of cases has gone up 285%. The number of tests we are doing has gone up to 89%. In Kaduna, the number of cases has gone up 154% in the last 1 week, compared to a 32% increase in testing. In fact, if I test you in Kaduna, you have about a 1 in 4 chance of having a positive result. In Abuja, it's about a 1 in 5, the test positivity rate. That's huge. But what we've also noticed is that young people, the infection appears to be primarily driven by young people, and anecdotally is most likely linked to the episodes of mass gatherings we've been seeing over the last few weeks in the country. This has to stop, because if we do not stop this, the number of cases will continue to go up. We are already starting to see an increase in deaths across the country from COVID. While we've had a mild pandemic, so far, what's different between what we saw in April, May, and now is the complete disregard for non-pharmaceutical interventions. The complete absence of fear among people when it comes to COVID. If you are between the ages of 50 to 59, based on our data, 23% of those between the ages of 50 to 59 with COVID in Nigeria died. So it's the equivalent of you playing Russian roulette with your life. And we certainly, as a PTF, we certainly cannot sit down and observe this happening and just leave everything to chance. Because if you do, I can tell you that these numbers are not going to come down on their own. There has to be a change in people's behavior. There has to be a change in our risk perception. Over the next few days, we'll be taking major decisions regarding some of the interventions that will be required in order to get back on track and to stop this clear rollback of our progress. So far, we know that the numbers are coming primarily from FCT, Kaduna, and Lagos. We've had meetings with FCT on Monday. We also met yesterday evening with Lagos, and we will be meeting later on this evening with the National Economic Council, with the governors. And there will be a number of measures that will be very likely introduced in the coming days. But what we want to remind people is that when it comes to COVID, mortality is strongly age stratified. If you're above the age of 50, if you have comorbidities like diabetes and hypertension, if you catch COVID, you're really not in a good place. So please stop following the crowd. Because if you catch COVID, it becomes a personal calamity and a calamity for your family. It may not be so for the rest of the crowd. And we know more and more people are dying as a result of this. We will communicate the measures that will be required over the coming days once we've had additional discussions with the state governors as well as with our principle. In terms of travel, there continues to be a very high risk of contracting the virus when it comes to mass travel during the festive season. We'll continue to urge everybody to avoid traveling this season unless it is essential travel. This doesn't matter whether it is domestic travel or international travel. We urge everyone to continue to maintain a high level of caution. If you have symptoms of COVID, please do not enter a public transport. Please do not come into office. Please stay away. One of the commonest symptoms we have been seeing is that of a loss of smell. So if you cannot smell your perfume and you've had a cold, then you probably need to have a test done because you may end up spreading COVID. Fever continues to be the commonest symptom, followed by cough and shortness of breath. But a sudden loss of smell or taste, especially if it is linked to sore throat or other respiratory symptoms, is highly suggestive of COVID-19. Finally, I just wanted to continue to urge state governments to enforce non-pharmaceutical interventions and to enforce the restrictions on mass gatherings, to put in place enforcement teams, and to also invest in the resources they have been given now by opening up treatment centers, sample collection centers, and start preparing, because we may be in for a very rough ride. Thank you.
Thank you very much, Dr. Sani Aliyu, National Coordinator.
Yes, thank you. One question here about whether we're engaging in local communities. Yes, it is part of our planned committee engagement strategies. We are going to be explaining the vaccination. I think most Nigerians by now know what vaccination is. Vaccination against polio, against tetanus, against all the other kinds of routine vaccinations they get. So it is not new. But there are those who we believe may resist what we call vaccine hesitancy, which we have seen in different countries, not only in Nigeria, in America. There are people who say they don't want to take it. In UK, they do. Even some health workers were said to have refused it in some countries. So it is not a new phenomenon. But we intend to, of course, sensitize the public about it, and particularly those who are vulnerable, who know that they are greater risk of getting serious harm if they contract COVID-19. So those are the ones we are going to particularly target with information that it is their own best interest to take it. The spread of vaccination will definitely have to give consideration to those who are vulnerable, those who will be the ones who generally suffer the brunt of COVID infection. So to answer your question simply, yes, we are going to target the population with the benefit of the vaccine.
Social gatherings, and yes, any social gathering at the moment is of significant concern to us. We've already reached out to NIMSI. I spoke to the DG earlier on this morning. He has assured me that they are aware of the PTF and NCDC guidelines with regards to COVID-19. They are working already to find a system for doing the update online. And he has requested that we give him another 48 hours to come up with a plan that would mitigate this risk. So I'm sure they are very much aware of the issues, and they will work with us to mitigate any risk of further transmission. So yes, with regards to the borders, the chairman would speak in Hausa, but just wanted to say that we are aware that the borders, some of the border posts have been opened. There were clear reasons for this related to the need for us to get our economy up and going. We had discussions with the CG Immigration. We've agreed that the semi-border post will be taking it similar to that of an airport, And we'll be introducing rapid diagnostic testing, hopefully early in the year at SEMI. And we'll continue to monitor the airport health officials in most of the land borders. So we will upscale this and make sure there's some close monitoring. But having said this, I think it's important for the public to know that this current surge in cases is not driven by importation. No, it's driven by our behavior. We've looked at our data over the last 90 days or so. Even at the moment when we are having a slight increase in the number of positive cases coming in, we are averaging across the country at about 12 cases per day at day 7 coming up positive. Since the epidemic took off properly, we've never had less than 80 cases reported. In fact, we've been averaging at between 150 to 200 cases for several months before the recent rise. So it's community transmission, it's our behavior, and we need to change. Thank you.
Well, thank you once again. Just before I answer the question, there's an announcement that in civil aviation, of course, you all know how this whole COVID has affected the industry so very badly. So we took a decision to waive certain fees being charged by FAN for the period of 6 months from April to September 2020 on the following revenue lines: ground rent, rent, service recovery charge, and concession fee for concessionaires who pay yearly fixed rate in advance. And of course, these are only for FAN-controlled airports. This is in addition to the 5 billion that government had doled out, and while government is still considering how it can help look into the aviation industry again and come up with solutions and some further palliatives, inclusive of the earlier ones from Central Bank that would be able to give loans at single digits. To say that this thing is real, it is real. You all know my best friend of blessed memory, late Sam Inda Isaiah, a very serious-minded person, very diligent, very careful, very meticulous, very apt. He's fallen to COVID. I'm almost losing counts of the people that I know, friends and associates all over the place dying on this menace. A spoon of caviar and a glass of wine is not worth the trouble, but you must clutter yourself within confined areas to dine, to have fun. Please think twice. And of course, the solution is to take responsibility. Take responsibility. Please, Nigerians, take responsibility for the good of all of us. Maganar, well, in Hausa now, the question came in Hausa. Maganar buɗe kafofin shigowa ƙasa da kuma me zai jaza. Lallai ne wannan annoba tana shigowa daga waje. To amma yawan abin da ke shigowa daga waje din bai kai na wato harbin juna da ake yi ba a cikin unguwanni da loko-loko da wuraren zama da gidajen abinci da wuraren mu'amala da kasuwanni da makamantansu. So babban al'amari shine wato a tabbatar da an ci gaba da tsaftace jiki, musamman wanke hannuwa da shafa sinadarin da ke kashe ƙwayoyin cuta da sa takunkumi da kuma tsaya wato nesa da juna kamar yadda muka ce a baya, zaman kuɗa da buzuzu. Wannan shine muhimmiyar hanya wacce za ta tabbatar da wannan cutar ta kwaranye. Kuma idan da mu ƙauyenmu inda ni na fito wato Dubawa ko sabon garin Sirika rabe da Shargalle in ka taɓa zuwa. Idan da dukkaninmu za mu sanya takunkumi, mu dinge kuma wanke hannunmu, kuma mu rika tsaya nesa da juna. Idan mutanen da ke wato babumi kusa da mu, ko suke katoge ko dage, ba su ci gaba da yi ba, to sai sun harbe mu. Saboda kowa da kowa ne ya kamata idan a zana lafiya. Wannan shine gaskiyar magana. Mutuwa kawai ake loko-loko. A yi haƙuri, a tabbatar da an bi dokoki. Lalle ne za a kawo na'urorin gaggawa masu iya tantance wannan ƙwayar cikin gaggawa, ƙwayar cutar cikin gaggawa. Za a sanya a surare, amma ba su isa ba. Abin da ya isa shine mutum ya ci gaba da kiyaye doka, ya rika bin kuma umarnin masu kiwon lafiya. Allah ya tsare mu. So before we close, gentlemen of the press and our viewers, the government of Nigeria is taking this very seriously. Mr. President will be briefed. Further directives will come up, certainly by Tuesday, as we said. And whatever it is, we crave your indulgence to keep our country safe and keep our world safe. Thank you very much indeed. Had suffered tremendously due to COVID-19. Assuming someone is selling food within the terminal building, he hasn't sold in 2020. As far as he's concerned, there was 2018, 2019, and there will be 2021. He didn't see 2020. So we're saying that part of what we would do to support those businesses, to ensure that they remain alive as a very responsible government, and that is responsive, and that is social democratic in nature under President Muhammadu Buhari, we thought that we should give them some more reprieve, some more help, some more succor, by waiving the charges that they ought to have paid, because they're paying us. So from April to September, we waived that. And that's what we're saying. It is not about airfare or individuals that are going to fly. And just to also say that as the airports are opening more and more, perhaps within the next 3.5 to 4 weeks maximum, actually 3.5 weeks, we would be opening Kano Airport, for example. We would be opening also Lagos, subject to 1 or 2 things being achieved recent now. And to say that we would see some propensity to fly would be increasing. The sector will come back gradually. And so those people that are doing businesses will begin to earn money from the business, and the passenger number will begin to increase, certainly. But the key thing there is to ensure that we're all safe and to follow the protocols. And I'm happy to announce that our airports are compliant with these protocols, and we are actually one of the top in the world in compliance. So we thank Nigerians and those that are using our airports as well for this. Thank you very much.
Thank you very much.
Other honorable ministers here present, members of the PTF, gentlemen of the press, good evening, everybody. I want to sincerely thank the honorable minister for sitting very, very tight for the chairman. A few words of advice have been given. First and foremost, you have been reminded that you have to, if need be, postpone your travel plans for now because of the rising cases of the pandemic in this new wave. So if you have to, if it's not too essential, you have to postpone your journeys, postpone your celebrations, because it is he who is alive that celebrates. You were also reminded that the infection is primarily linked to the youths, and the youths carrying the infection or transmitting the infection is as a result of their convergence from time to time, social gatherings, going to parties, and the rest of them. So we have to, as parents, as leaders, we have to take responsibility for talking to our people, talking to our children, talking to our families, on the need to keep safe and avoid social gathering, large crowds. You have to have a change in your behaviors and your attitudes. The rising cases are not coming from the blues. They are coming from our behaviors, from our attitudes. It appears we have forgotten that the pandemic, the virus is still virulent. So we are advised to please remind ourselves of the need to observe those non-pharmaceutical interventions. The vaccine, you've been reminded, cannot solve the problem alone. It has to come from a combination of our attitudinal behaviors, which means that you have to observe completely all those measures that are being ruled out for you to remain alive. And then please, you are advised to think properly, reflect on our attitudes, and then, of course, choose to stay alive. On behalf of the chairman, I want to thank everybody and to ask you to please choose to remain alive until we meet next week. Thank you, and God bless you.